Veterans Service Program Update by James R. Vale. A thumbnail shoulder-length photo of Jim Vale in a serious pose accompanies his Veterans Service Program update. Jim is clothed in the standard previously described long-sleeved dress shirt, highlighted by the design of the BVA logo in the front of the shirt just below the left shoulder. There is no photo caption. The content of Jim's update begins with the following. Whom do you call when you are admitted to a non-VA hospital for emergency care? About 2 years ago, I found myself with a medical emergency and needed to go to the emergency room right away. The nurse on the VA hotline told me to call 911. When I arrived at the ER, I was quickly triaged, hooked up to an EKG, and had tubes stuck in my arms. While waiting to see the ER doctor, I was greeted by a representative from the private hospital's billing department and her credit card machine. She wanted me to make a $500 payment. This reminded me of a scene from the famous 1971 movie, The Hospital. I explained to her that I was a service-connected disabled veteran and that the VA is the sole payer for this visit. I told her that the hospital needed to bill the VA, not me. What is the group number? She asked. There isn't a group number, I replied. You need to contact the local VA hospital and give them my name and social security number. It was as if they had never dealt with a veteran patient before. I did not give in, and she eventually left. As a veterans advocate, I know the importance of notifying VA within 72 hours of my hospital admission, but VA at the time did not make it easy to report my admission. I called my local VA medical center. However, the switchboard operator did not know where to transfer me to report my ER admission, nor did a few other departments to which I was transferred. Eventually, I was transferred to an unlisted extension to leave a voicemail. How would I prove that I left a voicemail? I ended up calling the VA nurses helpline, but was warned this may not be sufficient. Then I called my primary care team and left a message. Still not satisfied, I went to va.gov and submitted an Inquiry Routing and Information System, IRIS inquiry, https://iris.custhelp.va.gov/app/ask, so that I would have an electronic paper trail. Ironically, I later received a response to contact my local VA to report the admission. I called my local VA hospital back and spoke to an administrative official in the VA ER. Again, how do I prove this? Clearly, there needs to be a better way for veterans to report an emergency hospital admission at non-VA facilities. I am pleased to report that effective June 8, 2020, VA now has a toll-free number and an email address we can use to report emergency care. Write this down or have it otherwise available. If you are a veteran with a medical emergency and need to report to VA your ER admission at a non-VA facility, you can call 844-72-HRVHA 844-724-7842, or send an email to vhaemergencynotification@va.gov. I recommend that you call and send the email. I do appreciate the support from all those at VA who ended up helping me make the reporting process easier, but this is not the end of the story. The clerk who originally checked me in at the private hospital's ER front desk also told me that the hospital did not accept VA. I asked her, "Do you accept Medicare and Medicaid?" She replied, "Yes, of course." I politely said, "Then, per federal law, you also accept VA." Her facial expression was a warning to me for what was coming next. After I was discharged, I promptly called the hospital's billing department and asked them to bill the VA as the sole payer, as I am a service-connected disabled veteran and, per Title 38, VA is the sole payer. To my dismay, the hospital instead billed my private health insurance as the primary payer and billed the VA as the payer. Since these claims were not billed correctly, VA denied them multiple times. After each denial, the hospital billing department representative refused to call VA and told me that I needed to take care of this. I was stuck between the provider and the local VA fee basis office, and nothing was getting done. After about 9 months, I was put into collections for the unpaid copays and out-of-pocket expenses. It felt like no one was listening. On top of all that, my private health insurance billing information was shared with the ambulance company, the ER physician's billing office, and the billing department for every doctor and specialist I had seen. All of them ended up billing my PHI and sending me a bill. As you would expect, I was furious. If you find yourself in a situation similar to mine, try first to take some deep breaths. Then call the VA Office of Community Care, OCC, National Call Center at 877-881-7618. The OCC representative called my providers on my behalf, got me out of collections, and helped me break through a lot of red tape. Most important, that office provided the way for payment of all my related medical bills. For more information about OCC, visit https://www.va.gov communitycare/about_us/contacts.asp. My advice is to use these resources and not give up. Feel free to contact the BVA Veteran Service Program if you need help.